Good evening, everyone, and welcome to today's session. Psychiatry. We have been revising for the past 10 days. Good to see Sushil, Nain, and many more who are all online. Please drop a line to all your classmates that the live class is started. So every day, I promise to spend an hour with all you guys, wonderful guys, preparing for the NEET PG. And I'm going to charge you, add that energy for you, petrol for you to prepare for this ruthless, merciless exam called NEET PG, where you have to master 19 subjects, consolidate everything, and face the examiner with 160,000 NEET PG aspirants. You should be in the dream top 5,000 ranks. So how are we going to make it happen? So, doctor, let's make the great beginning. Can the online students can punch whether the voice is loud and clear? So, yes. Now, continuing with the topic of depression. Good. What is the first line treatment for the major depressive episodes which are having atypical features? So these are all flashcards. In the Incus learning app, on one side you have the question, you click on it, it will toggle and show you the answer. And if you're not sure, you can bookmark it and do a revision in the last moment. So MAVO inhibitors are particularly helpful in atypical depression. But what is the problem with MAVO inhibitors? Orthostatic hypotension. So that is the reason still, even if atypical features are there, MAVO inhibitors are very effective. Still, SSRIs are the first line of the treatment when the examiner asks this question in the tomorrow's exam. Wow, that's good to hear, Dr. Salunke. Thank you, sir. Last 2 years were full of struggle and depression, but you helped me throughout, and I got selected in doing my MD pathology. Very good. A pathologist is like a Supreme Court Chief Justice. Physicians like me, MD general medicine guys, are 420 liars. We only keep tell stories. Maybe this could be clinically SLE. This could be rheumatoid arthritis. This can be mixed connective tissue disorder. Blah, 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 blah. We are vocal diarrhea physicians. Much worse than us are the radiologists guys. They look at shadows and then keep on interpreting the shadows and tell that maybe this could be pineal gland, this can be pituitary tumor, this can be anything. But the real truth will come out from the pathologist. I'm so proud of you, Dr. Salunke, that you have taken up MD pathology. I wish your eagle eye will catch those finest diagnoses which will bring out the truth. Because there can be only one truth, and that truth will be known only to the pathologist. So what are the indications of electroconvulsive therapy in major depressive disorder? If the patient is unresponsive to pharmacotherapy, if the patient cannot tolerate pharmacotherapy like pregnancy, a lot of times is a favorite question. Can you give electroconvulsive therapy in pregnancy? Yes. Answer is a big yes. If there is a rapid reduction of symptoms is desired, for example, if the patient is having an immediate suicide risk, if the patient is completely refusing to eat, to drink, if the patient is in catatonia, there are all the scenarios where you can be able to treat with electroconvulsive therapy. I'm sorry, I forgot to, yes. Yes. I hope now everyone can see the slides. Good. The seizure, which is induced by the ECT, it should not last longer than how many seconds? It should not last longer than 90 seconds, usually between 30 to 60 seconds. Usually there is a pre-medication with atropine followed by general anesthesia. And for that purpose, what is the general anesthetic which is used to give electroconvulsive therapy in case of a suicidal depression? Methotrexate. And what is the typical muscle relaxant used at the time of ECT? Typically surgenalcorin. Generally, you require 6 to 12 treatments. Average is 7 over a period of 2 to 3 weeks. But a significant improvement will be noted after the first treatment of electroconvulsive therapy. You should know the regime is what I want to underscore. So what are the common side effects of ECT? Does it lead to anterograde, retrograde, or both kinds of amnesia? Both the kinds of amnesia, retrograde, anterograde, but they usually resolve within 6 months. There can be other transient side effects like headache, nausea, muscle soreness. Now, comes some interesting clinical vignettes. Prema is a software engineer, 26-year-old, complains of sadness. Her boyfriend of 8 months has ended their relationship 1 month ago. She describes the history of failed romantic relations. And she says, I don't do well with the breakups. Prema reports that although she has no prior psychiatric treatment, she was urged by her boss in the office to seek therapy. Prema has arrived late to work on several occasions because she was oversleeping. She also has a difficulty to getting out of the bed. And whenever she's asked to get out of the bed, it is difficult to walk. It is like my legs are weighing almost a ton. She feels fatigued. She feels fatigued. And she spends almost 15 hours in the bed. She thinks that she is suffering from serious medical condition. She denies any significant changes in appetite or weight. Although she did not miss work days, she has a difficulty concentration. She quickly gets tears. She carries a handkerchief in front of clients. She feels tremendous guilt for not being good enough to get married. She says that her close friends are concerned because she has been spending her weekends in the bed and not answering their calls. So, even though she's doing all this, she suddenly becomes brightened. She becomes very happy while she's talking about her newborn nephew and her plans of visiting the London to meet one of the old friends. Prema denied any suicidal ideation. So what is your diagnosis? What is your differential diagnosis? This is how the examiner is going to ask you the question in the tomorrow's NEET PG, USMLE, any exam you go. So the Prema's diagnosis is a major depressive disorder with atypical features. What are the atypical features in her depressive illness, doctor? Sadness, fatigue, poor concentration, hypersomnia, feeling of guilt, anhedonia, impairment in social and occupational functioning. And the atypical features is she exhibited mood reactivity. That is, whenever any positive thing is there, like going to London to meet a friend or talking about the news of a nephew who is born, her mood brightens in response to the positive events. And similarly, her complaining of heavy feeling in the legs, that's called leaden paralysis, and hypersomnia. So all these basically are indicative of reactivity, mood reactivity. Similarly, she has a long pattern of interpersonal rejection sensitivity, because she keeps saying, oh, I don't do well in relations, I can't manage the breakups, etc. So interpersonal rejection sensitivity. So these are all the things about her atypical presentation of the major depressive disease is what you need to remember. So what is the close differential diagnosis for major depressive disease with atypical features? Adjustment disorder is one of the important differential diagnoses. So now comes the question of the tomorrow's NEET PG, MDD with atypical features. What is the treatment? You can use MAO inhibitors like phenylazine. It is much superior than TCAs, especially while treating MDD with atypical features. But still, SSRIs are the first line of the treatment. So the combination of pharmacotherapy, psychotherapy has been shown to be more effective for treating mild to moderate MDD is what you need to remember. Now, what are the melancholic features of depression and what percentage of patients show melancholy? Around 25 to 30% of the patients with the depression show the melancholy. There will be anhedonia, early morning awakening, depression worse in the morning, psychomotor disturbance, excessive guilt, anorexia. They are all the melancholic features of the depression. Now, what are the atypical features of depression? Hypersomnia, hyperphagia, reactive mood, leaden paralysis, hypersensitivity to the interpersonal rejection. Oh, I always cannot do good with these breakups. Oh my God. That is hypersensitivity to interpersonal rejection is what you need to remember. Now, what are the mixed features in MDD? So, maniac and hypomaniac symptoms present during the majority of the days during the MDD, like elevated mood, grandiosity, talkativeness, pressured speech, flight of ideas, racing thoughts, increased energy, goal-directed activity, excessive involvement in the dangerous activities, decreased need for the sleep. They're all the mixed maniac, hypomaniac features. If there is catatonia in MDD, will it be responsive to electroconvulsive therapy? So we should remember, catatonia is one important indication, just like suicidal ideation in a depressed patient. Pregnancy-like condition where you can't give antidepressants. Similarly, the presence of catatonia, they're all the indications for electroconvulsive therapy is what you need to remember. So what does catatonia include, doctor? Catalepsy, which is immobility, purposeless motor activity, extreme negativism or mutism, bizarre posturing, echolalia. Hello Mary, bring the injection Mary, bring the injection Mary. Whatever you talk, the patient in the ward will be talking whatever you are talking. That's called echolalia, is a part of the catatonia, is what you need to remember. So what are those psychotic features that can occur in depressive disorders? Delusions, hallucinations, they can be there in 24 to 53% of older hospitalized patients with major depressive disorder is what you should remember. Now comes the peripartum onset of the major depressive disorders? During pregnancy or within how many weeks following delivery you call peripartum onset of MDD? 4 weeks following the delivery. Now, seasonal affective disorder. People get depressed in winter season, etc. So what are the triad of clinical features that define SAD, seasonal affective disorder? Irritability, craving for eating carbohydrate, hypersomnia. They are the triad of seasonal affective disorder is what you need to remember. So what is the treatment of the seasonal affective disorder, or otherwise called winter depression? So there is a temporal relationship between major depressive disorder and a particular time of the year, most commonly the winter, but it can occur in any season. Similarly, there can be patients with fall-onset SAD, that are otherwise called the winter depression. They often respond to the phototherapy, light therapy is what you need to remember. If there are psychotic features in major depression, how do you want to treat? You need to combine antidepressant and antipsychotic or even electroconvulsive therapy. So what is a normal bereavement? If somebody who is close to the family happen to be lost, what is the normal bereavement? Bereavement का दूसरा नाम होता है simple grief. It is a reaction to a major loss, usually of a loved one. So the normal bereavement should not include any gross psychotic symptoms, disorganization, or active suicidality. Any of these things should not be there. If you like to call that as normal bereavement is what you need to remember. So some of the points that you need to be quite sure when you're going to the exam, doctor. Yes. Depression, most commonly, what is the age group, doctor? Is it middle-aged men or middle-aged women who are more often depressed? Middle-aged female. What are the neurotransmitters involved in depression, doc? You should remember serotonin, norepinephrine, the monoaminergic system disturbances are responsible for the depression. What is cognitive triad of Beck? Hopelessness, worthlessness, helplessness. Hopelessness, worthlessness, helplessness is called the cognitive triad of Beck. So, on Beck, cognitive theory of depression, there are 3 negative thoughts. What are they? Negative thought of future, negative thought of environment, negative thought about self is responsible for the depression. Which part of the brain there is an abnormally diminished activity when there is a major depressive disorder? Typically in the prefrontal cortex, prefrontal area. Depression is a feature of which medical conditions? Hypopituitarism, hyperthyroidism, hypothyroidism, adrenal disorder. There is a list of medical disorders leading to depression. Persistent feeling of guilt. Where do you see in depression? DSM-4. What is the duration criteria if you want to make a diagnosis of depression? 2 weeks. Please don't forget this golden number. 2 weeks is the time required for you to make a clinical diagnosis of depression according to the DSM criteria. So what are the symptoms that must be present for the diagnosis of major depressive disorder? recurrent suicidal tendencies, insomnia, indecisiveness, that defines major depressive disorder. Disruption, disorganization of the biological rhythm, where do you see? In case of depression. Nihilistic delusions, they are typically seen in three conditions. What are they? Endogenous depression, double depression, and in elderly people who are very much aged, they develop involutional depression. In all this, there will be nihilistic delusions. दुनिया नहीं होगा, कलयुग का अंत हो रहा है, कोविड आने के बाद, कोविड नहीं है तो भी. That is called nihilistic delusion. What is a psychotic feature? Where do you find? In any kind of, even if depression is mild, do you get psychosis? No. Only in severe depression, psychotic feature is seen. So how will be the psychotic features in depression? Typically, there will be mood incongruent psychotic features. So whether the mood is low or mood is high, psychotic features can very much happen. That's the reason it's called mood incongruent psychotic feature, is what you need to remember. Intense nihilism, somatization, agitation in the old age, they're all the hallmark symptoms of which condition? Typically in involutional melancholia. Dysthymia. What is dysthymia? Dysthymia होता है डिप्रेशन का एक mild kind of depression. If major depressive disorder is like a single malt scotch, dysthymia is like a beer. Okay, so chronic mild depression, but it is chronic. So what is the most common type of post-puerperal psychosis? Between depression, anxiety, mania, suicide, depression is more common in the post-puerperal psychosis. A 41-year-old woman presented with a history of aches, pains all over the body, generalized weakness for 4 years. She cannot sleep because of the illness, and she lost her appetite. She has lack of interest in work, does not like to meet the friends and relatives. She denies feeling of sadness. What is the most likely diagnosis? Major depression. So you must be very sure on what clinical features define major depression. That's what we have been discussing all the time. A 64-year-old male is brought by his wife. He thinks that he had committed sins throughout his life. 64-year-old. He thought of considering to commit suicide. He is also taking sessions with a spiritual guru. He does not get convinced when his wife tells him that he has led a pious life. Arey, tu Ram hai, Krishna nahi hai, Madhav nahi hai, tum to ekdam Raghuram ho. You are a very nice person, but that person's guilt is making him feel that he's a sinful guy. So how do you want to treat? You have to give both antipsychotic plus antidepressant in this given clinical scenario. 18-year-old boy or 18-year-old student complains lack of interest in studies for the last 6 months. He is frequently quarreling with his parents. He has frequent headache. What is the most important clinical approach for this case? First, you have to rule out depression. That's very important. A 40-year-old female presents with a history of a depressed mood, loss of appetite, insomnia, lack of interest in surroundings for the past 1 year. All these symptoms appeared soon after a business loss 1 year ago. How do you want to clinically manage this case? You have to give antidepressant treatment based on the effect of the profile of the drugs. That's important. So always, whenever we give antidepressants, they are attended with a lot of Adverse effects like tricyclic antidepressants, they have anticholinergic side effects. MAO inhibitors, they can lead to orthostatic hypotension. And some of the antidepressant classes can lead to sexual dysfunction. So you need to be very sure, depending upon the age of the patient, etc., etc., etc. A patient presents with a depressed mood, loss of sleep, loss of hope, feeling of worthlessness, and diminished concentration for the last 1 month. What is the drug of choice? Any day, doctor, depression, and what is the treatment of choice? If SSRIs are there in the options, SSRIs are the only answer, is what you have to remember. A woman had mild depressive symptoms after a few days of delivery. They disappeared 2 weeks in the postpartum period. What is the most likely definition? You have postpartum blues, then peripartum psychosis. So you need to know the definitions. Postpartum blues. How do you define postpartum blues? This is the favorite question of the examiner. How do you differentiate the postpartum blues versus postpartum depressive disorder versus postpartum psychosis? Blue is a temporary condition characterized by mild depressive symptoms, labile mood, develop 2 to 3 days following the delivery, but it resolves within 2 weeks of onset. Then major depression symptoms that persist beyond 2 weeks following the delivery, then that defines postpartum depression. And if there are hallucinations, delusions present within 2 weeks of delivery, you call it as peripartum psychosis. So the number 2 is important, doctor. Peripartum blues start within 2 to 3 days and resolves within 2 weeks. Then major depressive disorder, when do you diagnose? If it is beyond 2 weeks following delivery. Peripartum psychosis, within 2 weeks, hallucinations and delusions. You have to be 100% on these 3 important definitions, which are the favorite topic of the examiners. 100% you have to be sure. A patient presents to the emergency department with self-harm, indicates suicidal intent. Which condition does not warrant immediate psychiatric assessment? If it is acute alcohol intoxication with suicidal intent, you don't need to really run around to get a psychiatrist. Many drunken guys will say that I want to die and commit suicide. But if it is a formal thought disorder, any chronic severe physical illness is there or social isolation is there, and those people say, I have a suicidal intent, there's a chance. And you need to get a psychiatric consultation in place. A 50-year-old male with 3 years history of irritability, low mood, lack of interest in surroundings, general dissatisfaction with everything. There is no significant disruption in sleep and appetite. What is he most likely suffering from? Dysthymia. So any chronic smoldering mild depression को बोलते हैं dysthymia. A patient is depressed for the past 3 years, does not go out of his house much, and he is cut off from the society. But he has a normal sleep, normal weight. What is your diagnosis? It is still a major depression. So you should know DSM-4 criteria, DSM-5 criteria for depression, which we already discussed. Give me one example of SNRI, serotonin norepinephrine reuptake inhibitor. Favorite MCQ in exam. Venlafaxine. In the young people, for the management of depression, SSRIs should be carefully used, because what happens if you give SSRIs? SSRIs can precipitate a suicidal ideation. That's the reason, especially young people starting SSRIs, you need to keep this in mind. Now, when you combine SSRIs, MAO inhibitors, what are the features of serotonin syndrome? Tremors, agitation, hyperthermia, cardiovascular collapse, hypotension, they're all the features. So how does antidepressants mainly act? What is their main clinical effect because of? Basically, they change the neurotransmitter receptor sensitivity. That is their main action. What is the main action, mechanism of action of bupropion? What does it lead to? It leads to increased levels of norepinephrine, increased levels of the dopamine in the synaptic cleft. That's how the bupropion basically functions. Repetitive transcranial magnetic stimulation. What is it used for? Typically, for the treatment of depression, repetitive transcranial magnetic stimulation is the one which is being approved. A young female on antidepressants presents to the emergency with an altered sensorium. There is a wide QRS complex with a right axis deviation. What is the next best step? So you should remember, among the antidepressants, especially tricyclic antidepressants, they can lead to a prolonged QT. So whenever you are using tricyclic antidepressants, you should remember, don't mix SSRIs and MAO inhibitors. That can be fatal. QRS prolongation is an important indicator of overdose. There can be respiratory depression, hyperpyrexia, confusion, hallucinations in elderly. And because of the anticholinergic effects, you need to be careful with the tricyclic antidepressants especially. Among the tricyclics, nortriptyline has a lesser amount of anticholinergic effects is what you need to remember. So whenever tricyclic antidepressant overdose is there, the first thing that you need to give is sotabicarb to take care of the cardiovascular toxicity. Sotabicarb increases the extracellular pH and sodium concentration, stabilizes the cardiac membrane potential, and it will make TCS to bind more with the serum proteins, and it improves the renal excretion of the TCAs. इसलिए tricyclic antidepressant poisoning overdose में there is a very important role for sotabicarb to alkalinize the urine so that it will improve the renal excretion of TCS. It will make the TCS to bind more with the serum proteins. That's how it helps in mitigating the toxicity. So what are the 3 C's in the tricyclic antidepressant overdose? C for convulsion, C for the coma, C for the cardiotoxicity with arrhythmias is what you should remember. Rati, 26-year-old female, has been diagnosed suffering from depression. Now for the past 2 days, she has suicidal tendency, thoughts and ideas. What is the best treatment in her case? The moment depression with suicide tendency is there, electroconvulsive therapy is considered to be the management of choice. A patient comes in a stuporous condition. He gives the history, being continuously sad with suicidal attempts, not eating, sleeping for most of the times. What is the treatment? Once more, electroconvulsive therapy. The moment you see the word suicide in the question frame and ECT in the options. If you don't jump for ECT, that is a real suicide. A patient on antidepressant develops a sudden hypertension on consuming cheese. So MAO inhibitors like phenylcyprine can lead to the cheese reaction. Which antidepressant all the three things are there. Anticholinergic actions. It also blocks serotonin, norepinephrine reuptake. It leads to sedation. Tell me which antidepressant class we are talking. Tricyclic antidepressants. A patient on treatment for psychiatric disorder takes overdose of the drug, develops bradycardia, hypotension, decreased sweating, salivation. So what is the likely drug? So it should be a tricyclic antidepressant with all its anticholinergic effects. Amitriptyline. Tricyclic antidepressants, where are they contraindicated? So you should know all the contraindications of TCAs. Tricyclic antidepressants. Angle closure glaucoma, which can worsen because of their anticholinergic effect. History of seizures, liver dysfunction, any family history of QT prolongation, any hypersensitivity reaction. If patient is already taking MAO inhibitors, similarly TCAs plus SSRIs combination is not advised. So which drugs are known to have abuse liability? Buprenorphine, alprazolam, dextro, propoxyphene. Does fluoxetine like SSRI, does it have abuse liability? No, there is no abuse liability. How does tianeptine, the drug tianeptine, how does it act? It is a serotonin uptake enhancer. So doctor, on the online mbbs.com video library, 427 hours of video lectures containing 1500 lectures are available, and you can be able to do the revision. There are almost 10,000 PowerPoint slides of notes. This is all that you require to become the topper in the tomorrow's NEET PG. So take every opportunity, call our helpline 9000868 and get yourself subscribed to the video library. 2022 NEET PG edition we have recently launched with all high density video lectures, right? So take every chance to do a brisk revision, right? Now, what are the side effects of SSRIs? It can lead to insomnia, sedation, seizures, weight gain, especially weight gain. A lot of times this was asked as a MCQ in the NEET PG exam. Serotonin syndrome, how do you get? By combining what and what? Good to see Khan and many more who are all online. So please don't forget, with all the possibility, I try to spend at least 1 hour with you all guys, however busy the day. So don't forget to subscribe to this YouTube channel so that you get the notification and be part of our WhatsApp study group. We will shout out the moment the class is about to start. So on every Sunday, there is a full-scale grant test containing 300 MCQs. It is being broken down into 10 quiz tournaments containing 30 MCQs, quiz tournaments. So download the Incus learning app and subscribe to our quiz tournament, QBank, and then enjoy 50 full-scale grant tests and discussions, right? Now, serotonin syndrome, it is predictable. not idiosyncratic. Combining SSRIs, MAO inhibitors will lead to it. You have hypertension, hyperthermia, hyperreflexia. They're all the clinical signs. If you stimulate which nerve, it can lead to elevation of the mood. Vagus stimulation lead to elevated mood. So what are the various somatic therapies which are used in depression? Electroconvulsive therapy, deep brain stimulation, transcranial magnetic stimulation, etc., etc. So of all the various psychotherapeutic techniques, the evidence-based psychological therapy of choice for the depression क्या होता है? Cognitive behavioral therapy, CBT. Phototherapy, we use it in seasonal affective disorder, which is a depression. Increased suicidal tendency, why is it caused? It is a decreased serotonin in the neurosynaptic junction lead to the suicidal tendency. So what are the risk factors for the suicide in depression? If you're a male more than 45, if there is a child with conduct disorder, if there is a family history of suicide, there is a great chance of suicide in depression. Which type of depression suicides are more common? Involutional depression, psychotic depression, suicidal tendency are most common. Emily Durkheim, he is linked with work on which condition in psychiatry? So don't forget, doctor, shortly we are starting something called flashcards on the Incus learning app. You have a question, you check maybe what is the answer, then click, it will turn and show you the answer. If you're not sure, bookmark that flashcard. Like that, you have a collection of flashcards for the last moment revision before exam. Suicide. According to the Durkheim, suicide is not an individual act, it is not a personal action. It is caused by some power which is over and above the individual or a super individual. So he classified the suicides into egoistic suicides, altruistic suicides, anomic suicides, etc., etc. What are the incidents of suicide in India for 1 lakh population? 8 to 10 per 1 lakh population, typically the incidence of suicide in India. So much a need in the society for good MD psychiatrists. Suicidal tendency are seen in 3 psychiatric conditions. What are they? Depression, suicide ho sakta. Schizophrenia, substance abuse can lead to suicide. So doctor, with that, kabhi alvida na kehna. So let us study together. Dr. Murali Bharadwaz is your trusted companion, a classmate, roommate, benchmate, tablemate, to hold your hand, study every day, and take you to the winning path of becoming the topper in the NEET PG. Everything free on the YouTube. So please bring more of your friends to subscribe to our YouTube channel of Online MBBS and enjoy a great, wonderful winter evening. And while you study, this remains a good memory tomorrow when you become a postgraduate. Like our friend Salun K, once upon a time was sitting like you, but today he is a MD resident, a prodigious MD resident. So I'm so thankful whenever our students come back and say, sir, I got into this MD and now I'm enjoying doing my residency. That is the moment always, as a teacher, I'll be waiting for. See you all tomorrow. Thank you and good night.